Hello, my name is Alan Kraft, and I'm a social worker for the Kettering Health Behavioral Medicine Center Intensive Outpatient Programs. Today's video is about signs and symptoms of depression and some ways to manage depression. Depression is a serious health concern that affects about 5% of people globally, according to the World Health Organization. This means an estimated 280 million people in the world experience depression. Why is this important to know? When a person struggles with depression, it can be very common for that person to believe that he or she is the only one who feels the way they do and that no one will understand. This can lead to isolation and not receiving help. For some, there can be a degree of comfort knowing depression is common and that they are not alone. So what is depression? Depression differs from the usual mood fluctuations we may experience from day to day. Depression is a persistent sadness affecting how we feel, think, behave, and can lead to a variety of emotional and physical problems. You may experience difficulties in the completion of day-to-day tasks related to school, work, social activities, and relationships, and even feel like life isn't worth living. Let's take a moment to review some specific signs and symptoms of depression. Feeling a sense of hopelessness and helplessness, increase in irritability and agitation or restlessness, difficulties with focus and concentration, withdrawing and isolating from others, feeling run down, tired, or fatigued, increase or decrease of appetite, increase or decrease of sleep, including difficulties getting to sleep and staying asleep, feelings of worthlessness or guilt, loss of interest in activities, frequent or recurring thoughts of death, thoughts of wanting to end your life, or attempts at ending your life. If you do experience suicidal thoughts, it is important to get help immediately. This could come in the form of talking to a therapist, primary care physician, psychiatrist, calling the mental health crisis support number in your area, or going to the nearest hospital emergency department. If needed, call 911. You'll be pleased to know that depression is treatable with the support of therapy, medication, or a combination of all three. It is important to know that medication is not a cure for depression and will not make it just go away. Medications assist in helping your body create the necessary chemicals, such as serotonin and norepinephrine, to help decrease the symptoms of depression and make it more manageable. Therapy can also become a very important part of treating depression. Some of the therapy objectives in the treatment for depression may consist of being able to identify triggers, discussing past or present events, experiences that are connected to the depression, becoming more aware of one's own signs and symptoms of depression, creating a positive support system, and learning new coping skills. Here are some other things that you can do that can help manage depression. Create a routine. Depression can oftentimes take away one's routine, and one day melts into the other. Create a routine around meals, bedtime, hobbies, and interactions with others. Set goals. Each day, create a reasonable goal that you can accomplish. It will be important for you to be patient with yourself. You may find that you are not as productive as you are used to being. Exercise. Engage in physical activity that is good for you, such as going to the gym, yoga, going on walks. If you have concerns about starting an exercise routine, please consult with your primary care physician. Eat healthy. There's no magic diet that is going to fix depression, but pay attention to how much sugary and processed foods and drinks you are consuming. Get enough sleep. Difficulties with sleeping can be a sign of depression. It can be helpful to develop a routine around when you go to sleep and wake up. It can also be helpful to limit or remove the use of computers, television, and phone usage prior to going to bed. Allow yourself to have fun. Look for opportunities to do things that you enjoy, whether it's with others or by yourself. Try something new. Don't worry about how long the fun lasts. Take whatever the moment gives you. Pay attention to your thoughts. Depression taints the way we think. Depression tends to lead us to focus on what is not going right. When this happens, it can be helpful to think in a more reasonable way and even look for the positives that are still occurring. Avoid alcohol and drugs. Substance misuse is common in people who deal with depression. Although for some, it may provide a short-term moment of relief from the depression, long-term, it can make the treatment of depression difficult and/or lead to other problems. It is important to remember that depression is treatable, but there is no quick fix. It will be important to be patient with yourself as you enter treatment. Keep your appointments with your treatment providers. Let your providers and your support system know how you are feeling and thinking. Practice, practice, practice. You will be learning new skills to help manage the depression. Make sure that you are practicing these skills regularly. Lastly, give yourself time. I know you want to feel better now, but no one can determine how long it will take for that feel better moment to arrive. But by following these guidelines, that moment will arrive. If you continue to experience symptoms or begin to have suicidal thoughts, please go to your nearest emergency room or call 911 for assistance. We look forward to seeing you in group. Keep practicing your skills. You got this.